Let's see how liver microablation is done. This is microwave ablation needle engineered to deliver focused thermal energy directly into liver tumor, and this is a microwave generator. Under CT scan or ultrasound guidance, the probe or needle is advanced precisely into center of the tumor, ensuring adequate tumor coverage. And then the generator is started, which will deliver high frequency microwave that creates rapid and uniform heating even in perfused liver tissue where the RF is less effective. Energy is deposited inside the tumor and it will cause heat death of the tumor. It will produce a predictable spherical ablation zone with a safety margin. This minimally invasive technique offers curative treatment for small liver tumors with reduced complications compared to surgery. Thank you so much.